Hello, everyone, and happy Tuesday. Terrific Tuesday. We are so excited today to be speaking with Dr. Rob of the Center for Skin Wellness, going live. So we are live right now. And for those of you that are joining us, you are more than welcome to post some questions. Dr. Rob, just so you know, you can't see it on your end. I see it on my end. So I'll be answering or asking you the questions that come in. We've got some people here that want to be talking with you. So feel free to comment to us on multiple different platforms, on Facebook or on YouTube today. We'll be answering those questions for you. And we're excited to have one of our top-notch, if not the top-notch, actual dermatologist here in the Lakewood Ranch area to talk with us about a few things this morning. We've got 10 minutes with him as he is a very busy doctor helping and healing patients every single day. So welcome, Dr. Rob. Can you hear me okay?
Thank you, Jamie. Appreciate it.
Yeah, we're happy to have you.
Yes, there's a bit of a lag reason.
Oh, okay. So we'll have to bear through it somehow. It's the internet, you know, we can't, you never know what you're going to get. So you just stop me if I'm going too fast or what's happening. It may be just the storm that we're having right now. Who knows? But excited to have you on.
Yeah, there's a bit of a lag, so if I take a little while to respond, you know why.
You got it. So Dr. Rob, let's just jump right on into it. Tell us a little bit about, you know, how long you've been practicing dermatology and a little bit about yourself.
So I've been practicing dermatology for too long. No, for 23 years, believe it or not. I think we're going on 23. I did family medicine for a couple of years before I did derm, so I'm ancient. But yeah, so I've been doing that. I've been in this practice down here in Florida at this location since 2004. So you do the math. We've been in Florida for 18 years. Can't believe it, but it's been 18 years. So we've been here since 2002. I originate from Philadelphia, Pennsylvania. And yeah, so this has been our home for 18 years.
It's funny that after 18 years, you still say Florida instead of Florida.
I like the water in Florida.
No one's judging. So, you know, as a dermatologist, you handle so many different things, and we could be on a call like this for hours talking about what you do. But what we thought we'd focus on today is that August is National Psoriasis Awareness Month. And I know, as knowing you, that you are very passionate about treating psoriasis and that skin condition. Help us understand why and what Skin Awareness Month is all about, please.
Sure. Well, first of all, psoriasis is, it's been my passion for years because it can be a very debilitating disease. And it can be a disease that we can not cure, but we can really control to a really great degree. We used to have a lot more difficulty treating it because we didn't have the medications that we have today. But essentially, just to kind of give you an overview of what psoriasis is that it's one of those autoimmune diseases, which means that our body's immune system overreacts to itself and to things that it deems threatening. And it creates what we call an immune response, which we are actually hearing a lot of because of COVID, of people whose immune system goes out of control. And this is a little bit different, but it's where you have inflammation that involves not just the skin, but other types, other kind of systems in the body, like the joints, for instance. And that inflammation can lead to a overproduction of the cells that comprise the skin, and inflammation that lead to redness that cause generally these plaques that can be kind of limited to certain areas of the body, or in more severe cases can kind of go all over the body. And it can be not just psychologically devastating, but it can be physically devastating for people who have it and who have it bad. So there are, like all autoimmune diseases, there are mild cases, moderate cases, and severe cases, and we treat all of them. And the medications we have available to us today over the last 15 years have gotten better and better and better. So really, we can essentially kind of shut down the inflammation and control the disease, whereas before we were limited to what we could use. And the medications that were more serious, the side effects were more serious than the disease. So we're kind of in this golden age of psoriasis treatment, and I feel fortunate to kind of be at the forefront of it. And so I really like it. It can change the lives of people. It's quite amazing.
That's incredible. So someone just asked, does this make us more susceptible to getting the virus? And I'm assuming that she might mean towards COVID because it's an autoimmune disease. I mean, are you more susceptible to that?
So, they haven't said that psoriasis or psoriatic arthritis or these types of autoimmune diseases make us more susceptible. It's not one of those comorbidities directly that are associated with having a greater susceptibility to getting the virus. However, psoriasis, as we're learning more about, is associated with the comorbidities that can make people more susceptible to the virus, such as being overweight, obesity, diabetes, hypertension, high blood pressure, coronary vascular disease, coronary artery disease. So maybe not directly can make us more vulnerable to it, but those things that psoriasis can be associated with can make them more vulnerable to the virus. I don't know if I answered that directly, but yes, we just have to be careful with that. And the medications that we use, the newer medications, they're called biologics for the main part. And what they do is they target a part of the immune system that is elevated, that's high. And essentially the idea is to bring that higher elevated immune mediators or cytokines down to a normal level. But the potential is that it may lower the immune system a little bit more. So we don't tell our patients to stop the medications, but we just tell them to follow the same guidelines that they would normally. Wear a mask, wash your hands, for 20 seconds, keep physical distance, avoid large crowds, all the things that we would tell anyone else to do to protect themselves from the virus.
I love that you said physical distance for socially distant. I think that, I wish we would have all come to terms with that term instead, because really you just need to be physically away from someone, but socially distant is just a whole, let's stay connected, but just not next to each other. So you obviously.
Yeah, I mean,
Go ahead.
So I was always at the social distance. We don't want to socially distance. It's bad enough that we have to stay away from each other physically. I think it's really important that we socially connect, because we're all kind of isolated through this. So physical distance, stay away from each other, physically, not emotionally or psychologically.
Yes. So let me ask you this. You can hear your passion about psoriasis in your voice. And this is a question that a lot of people have asked. What are the warning signs that you might have psoriasis before it's full blown? Are there any warning signs? Is there something that people should look out for? Where should how would they know?
So most people, the majority, have skin rashes. And generally, everybody's different, but the kind of classic look for psoriasis is when you get these red or pink patches, or we call plaques if they're elevated, that have this kind of silver scale to them, or thick, dry scale to them. They can start off being small, little round bumps or flat, we call macules or flat spots, and then develop into larger patches or plaques. Generally, they're over what we call the extensor surfaces, meaning like elbows, knees, but you can get them in the scalp, and you can get it on the butt, you can get it anywhere on the body, but those are like the classic signs. So if you see kind of these rashes that pop up. Sometimes they're itchy, sometimes they're not. And then they start getting bigger and you start seeing more of them, then that's a sign that you might have psoriasis. And there's also psoriatic arthritis, which is kind of a more serious version of it, where it can affect the joints and you can get joint swelling and stiffness, and potentially the joints can show destruction or erosion, and that can be progressive. And if you don't catch it in time, sometimes that can be irreversible. So that's when people come in and we diagnose them with psoriasis, we make sure that we ask them every time if their joints are affected, because that puts them into a higher risk category, and that makes them more vulnerable to this joint destruction. And you want to get them on the proper medication as soon as possible.
Wow, that's very interesting. Last question, is it hereditary?
So we think it's about 50%. There's a genetic hereditary predisposition to it, which means that about 50% there's no family history. And that's give or take. That's approximate. So some people say, yeah, I have my father and my uncle had it, or my mother and my grandmother had it. But a lot of times we'll ask them if they have a family history of it, and oftentimes they say no. It's just that they happen to be the lucky one. So yes, there can be, or sometimes not be.
Gotcha. Well, we know that you are very busy and it's a surgery day, I believe, on Tuesdays, so you probably have some stuff to get back to. Last but definitely not least, what advice do you have for anyone watching about keeping safe during these times? I know your office is back to full operations, so help us understand what you're doing to keep safe there, and then what advice you have for patients about continuously seeing their doctors on a regular basis.
Yeah, I'm glad you asked me that, because I think there's a lot of confusion, and we're have heard mixed messages from policymakers, politicians, and scientists. I think that the rule of thumb is wear a mask when you're outside in crowds. I mean, you don't have to. If you're alone and you're outside exercising and there's no one near you, you don't need a mask. I mean, it's common sense stuff. But if you go into a building where there's going to be people, wear your mask. And now these are 2 counties where it's mandatory, and I think that should have happened a long time ago. You can't go wrong wearing a mask. It can only protect us. It can't hurt us. It's uncomfortable. I understand that, but it can only help us. Is it foolproof? No, but it does protect us. Whether you have a cloth mask or a surgical mask, if you get your hands on an N95 mask, any mask can help. So I really would urge people to follow that. I know it's a pain in the butt, but it could save not only your life or your family's life, it could save other people's lives. And why would anyone want to spread something to someone else and potentially harm them, or worse, kill them? So wear your mask. Safe distance, we talked about that. Physical distance. If you're going to be in a crowd, try to have safe distance. There's no reason to be crowded together until we figure this out and get a vaccine or the virus. We have better understanding. Wash your hands. I recommend that you wash your hands. This is kind of a dermatology pearl. Wash your hands with soap and water instead of using the alcohol hand sanitizers. The reason being is that I'm seeing a quote unquote rash of hand dermatitis because people are overusing hand sanitizers. It's killing their skin. Soap and water is a better option. Wash 20 seconds, happy birthday twice. But that, if you can get your hands on soap and water, that's really better. If you're in a pinch and you have no other choice, then you got to do what you got to do. But try to hand wash with soap and water. It's a better option.
Got it. And I know your office has done some things as well to keep people safe. You've got the plexiglass. You're scheduling appointments differently. Are you still doing the morning appointments for high-risk patients as well too? Early morning appointments?
Yeah, we're trying to get the elderly patients with the comorbidities to come in early, or if they need to come in late, so there's less possibility where we're really trying to stagger our patients so there's only a few people in the waiting room, keeping them distance. We take temperatures for every patient. We give them questionnaires. So, you know, we're really trying to do our best.
Well, we appreciate you joining us today, and we've got a lot of people that are commenting, saying hi. Brita saying hi. B. Marie Jones is saying that you have changed her life, so which is pretty incredible.
I cannot hear you now.
Oh, okay. Wow. Well,
I see your lips moving, but I can't hear you.
Well, we're done.
We're done.
Thank you.
Thank you very much.
I don't know what's going on with the internet, but thank you. And we're going to end the broadcast. Good job. Bye, everyone.